So my talk today would be devoted to a very interesting observational trial that we are supporting and running together with the National Research Center for Hematology in Moscow, a company called Enroll.Me, which supports us in this research, and about 10 clinical centers all over Russia who are doing a great job collecting data and helping patients with hematologic malignancy and hematologic disease to overcome COVID-19. So as we know, COVID-19 in cancer patients has been a really important topic since the very beginning of pandemic. The earliest reports that we heard were from China in March 2020, when they described the first cancer patients with COVID-19, demonstrating high severity of disease and higher mortality rate. The major data on COVID-19 in cancer patients we heard at ASCO annual meeting, which took place in the end of May this year. And there were two brilliant talks delivered by investigators from the US and Europe. And both of the studies demonstrated high mortality rates as well as really severe disease in cancer patients. And if you look at the right side of the slide, you will see the risk factors, and this is the most recent publication in the Journal of Clinical Oncology. And in red bars, you see the risk factors which were statistically significant. And besides age and lung cancer, which is explainable, you may see that hematologic malignancy was actually associated with increased COVID-19. So we initiated in June 2020 an observational cohort study, and this study, we call it CHRONOS19, and this study the study has the primary objective to determine the outcomes, the treatment outcomes of patients with hematologic disease and COVID-19. As I said, we were also going to describe the clinical course of both diseases and explore risk factors for the severity and lethality of new coronavirus infection. The primary endpoint of the study is the 30-day all-cause mortality, and we currently reached the target number of patients already to calculate in the interim analysis at our first approach the mortality rate for this patient population. We're also exploring complications of COVID-19, rates of ICU admission and mechanical ventilation, and the most important, we are also exploring the course of the hematologic disease. So we would like to see whether the relapse rate or progression rate would increase in the patients with COVID-19. And of course, we will look into the overall survival and risk factors as I already described. The research is focused on adult population with any previously or currently diagnosed hematologic disease and laboratory confirmed or suspected based on clinical symptoms or imaging COVID-19, and of course with the known outcome of the disease. We also allow retrospective data input for those patients who were prospectively followed in local centers. We currently have 232 patients enrolled, and the study is still open for further enrollment. We are really happy that we have 10 participating centers, and we're again open to include more centers into the study. And we have already performed the interim analysis of the data, and it is going to be presented at the upcoming meetings and hopefully published by the end of this year.